This morning, we're kicking off a new series, Today's Heart Healthy Man. Over the next 3 days, we're focusing on heart disease, the leading killer of men in the U.S., a topic that's obviously close to home for all of us in the NBC family following last summer's loss of our friend and colleague Tim Russert, who died of a heart attack. Our chief medical editor, of course, at NBC is Dr. Nancy Snyderman, who has 6 tests that every man needs to have. Nancy, it's great to see you.
You too, David. And the reason we came up with these tests is because we recognize these are tough economic times.
Sure.
Guys don't like to go to the doctor, but these are things every man in this country has to know about his body.
Well, let's talk first about the leading one, which is cholesterol.
Right.
How often should you have it tested?
Well, about every 5 years, and what you need to know is the total number is one thing, but you need to be able to break it down. The total cholesterol, we want no more than 200, but this HDL, LDL, and triglycerides, another kind of body fat, blood fat, those are the things you have to know. And if you have a cholesterol of 240 or more, you double your risk of heart disease. So that's why that's important. But then if you break it down into just the HDL, good cholesterol, this is your bottom line number. Frankly, what you want to do is get your HDL up as much as possible.
Why?
Because HDL protects your heart against heart disease and stroke. That's the one that if you exercise, you can boost.
Right.
Now, this is the one to watch out for. LDL, the bad cholesterol. This is the max. You want to drive this down as much as possible. Sometimes you can do it with lifestyle changes. Sometimes you're going to need to do that with a statin like Lipitor.
Right,
but you want to drive that one down as much as possible. And then triglycerides. Sometimes people forget to get this one. It is a blood fat that goes along with the other two. This is the max. Drive it down. Sometimes you can drive this one down just with a glass of red wine.
Wow. All right, let's talk about another strong marker, and that's blood pressure.
Blood pressure. People know this magic number, 120/80. And you know what? We used to think that was normal. It's not good enough anymore.
Really?
Once this starts to creep around 129, and this creeps up to about 89, you're talking about pre-hypertension, and that's when it starts to kill you. So I think people should start to think more like this. All right? 100/70. Think of that. Now, some doctors may think that's a little low, but if you aim for that, then you at least have a little bit of a buffer.
Right.
And if your blood pressure is out of control, it can put you at risk for heart disease and stroke.
All right, let's talk about weight. Obviously, that's critical. And the BMI, break that down.
Body mass index. It is your weight in kilograms divided by your height in meters squared. You know what? Forget it. Doctors don't even have time to make that. So just know that there are ways, little dials that doctors can find, and what you want to do is aim for 21 to 25. That's the norm. If you're above 25 to 29, you're already obese. So that's what you want to strike for, 21 to 25.
Let's get to this other one that I've actually not heard of. It's the C-Reactive protein, or CRP.
Yeah, it's an independent test, usually used for high-risk people. This is sort of the range where people think you might be at risk. Aim for this, 1.0.
Okay.
But a C-reactive protein can be an independent risk factor for heart disease, especially in guys who have other risk factors.
We talk about urinalysis, but this was also interesting, depression as a marker for potential heart disease.
Urinalysis important. 3 things. Protein. Nope. We've moved on to depression. Here's why sadness matters. If you're sad, if your sex life is different, if you're drinking alcohol, and the ETOH is what doctors write down in your chart if you ever see it, that's when they worry that you're drinking.
Right.
That leads to stress hormones. Depression alone, untreated, doubles your risk of heart disease. And let me go back to urinalysis really fast. Simple thing. Pee in a cup, dipstick. They're going to check for 3 things. Protein, blood, and sugar. Why are those 3 things important? Protein can indicate that your kidneys aren't healthy. Blood may indicate tumor. And sugar, the big one, that can show if you're a diabetic and you don't even know it. Diabetes, an independent risk factor for your heart. These are simple things. You can get at any lab, but you have to know about them. And I think every 21-year-old guy has to already know what these things are.
Right. It's important to think about it even at that age.
All
and we just
through your life.
We can't provide this information enough. All right, Nancy, thanks very much.